Most of us probably have a working understanding of type 1 and type 2 diabetes, but what exactly is gestational diabetes? And joining me today to answer that question and so many more is Dr. Katherine Wolfe. She's a maternal and fetal medicine specialist with Summa Health. This is Healthy Vitals, a podcast from Summa Health. I'm Scott Webb. So, Doctor, thanks so much for your time today. I think that most of us are probably familiar with type 1 and type 2 diabetes, but what exactly is gestational diabetes?
Gestational diabetes is when there's too much glucose, which is sugar, staying in the blood instead of being absorbed and used for energy. This can occur in about 13% of pregnancies today.
Yeah, and my wife had that, and of course, initially I was alarmed, when her OBGYN said that to her, and then he said, it's pretty common, not a big deal, we know what to do. Wondering, what is the testing? Like, how do you identify that it's gestational diabetes?
Women are screened for gestational diabetes by taking a glucola test, and there's a variety of different ways to approach the testing. The most common test is a 1-hour glucola challenge, and if a mother has a high glucose result after taking that challenge, then the diagnostic test is a 3-hour glucola testing. If two values are abnormal on that 3-hour testing, that is consistent with a diagnosis of gestational diabetes.
Yeah, and are there any risk factors, or is there anything that women can do to avoid developing gestational diabetes during pregnancy?
So being healthy prior to pregnancy is the best way to decrease your risk of gestational diabetes. So having a normal body mass index, exercising regularly, and eating a healthy diet are ways to decrease the risk of gestational diabetes.
All right, so being as healthy as possible before you get pregnant, before you're carrying this other human around inside of you, that's a good thing. I get that. That sounds right. And does gestational diabetes affect the pregnancy in any way? Assuming that it's been diagnosed early and being treated properly, is there any real effect on the mom or the baby?
Yes, so gestational diabetes does affect both the mother and the growing fetus. So a portion of the glucose will diffuse across the placenta. So if mom has elevated blood sugars, the baby will also have elevated blood sugars. That can cause the baby to grow very large, and that can decrease the mother's chance of having a vaginal delivery. So if there's gestational diabetes, the rate of a C-section is increased. Additionally, the rate of having high blood pressure in pregnancy if you have gestational diabetes is increased, as well as having preeclampsia.
Yeah, and if a mom-to-be develops gestational diabetes during pregnancy, does that just sort of automatically mean that they're going to have to live with diabetes the rest of their lives?
No, only about 70% of women with gestational diabetes will develop lifelong diabetes, but it doesn't usually happen immediately after delivery. So usually after delivery, mom's blood sugars will go back to normal, but they do need to continue to be screened over the course of their life every 1 to 3 years because they have a high risk of having type 2 diabetes in their lifetime. They can reduce that risk by breastfeeding for 3 months or more. You can reduce your risk from 70% all the way down to 30%. So breastfeeding is very valuable for mothers as well as the baby. Babies that are breastfed are actually less likely to have type 1 and type 2 diabetes in their lifetime as well. Continuing healthy nutrition and regular exercise are additional ways to decrease your risk of having lifelong diabetes.
And doctor, as we wrap up, and I do appreciate your time, maybe let's just go over, some takeaways when it comes to gestational diabetes so that moms and families to be know exactly what they can do to be ready for pregnancy and also to try to protect themselves against gestational diabetes.
Great. Well, getting ready for pregnancy, it's important for all moms to have healthy nutrition. A prenatal vitamin is recommended 3 months prior to conception. The most important part of the prenatal vitamin is the folic acid, which decreases the rate of birth defects. So moms that have additional risk factors for developing gestational diabetes, such as being overweight or obese, or being physically inactive, or if they had gestational diabetes before, had large babies over 9 pounds, or have a history of having glucose intolerance, have an increased risk of gestational diabetes. So those moms, we recommend they get screened early at their first prenatal visit. If those screens are normal, the normal screen is between 24 and 28 weeks. For moms that get diagnosed with gestational diabetes, the first line of treatment is nutrition. So we recommend that they meet with a dietitian and a diabetes educator, go over a healthy diet in pregnancy, And then if they still have elevated blood sugars, we're going to recommend treatment to bring those blood sugars back down into a safe range for that developing baby. And treatment can consist of insulin, which is the first line therapy, or we can try an oral medication to help decrease blood sugar. Having well-controlled blood sugars in pregnancy is important for mom and baby, so it will improve mom's pregnancy course if we have well-controlled sugars in terms of having less hypertension complications of pregnancy, also having babies that are of a normal size, increasing their chance of having a vaginal and uncomplicated delivery. And then babies that have well-controlled glucose exposure have a decreased risk of having neonatal complications. So in an untreated gestational diabetic or someone who does not have blood sugars at goal, there's an increased risk to have a NICU admission for the newborn, increased risk of having metabolic challenges such as low blood sugar, jaundice, and having difficulty with breathing. So treatment is going to help both that mom and baby.
Well, that's all good stuff, doctor. Screening, early diagnosis, treatment. You've talked about how important that is for the moms, for the babies, and so on. So thank you so much for your time today, and you stay well.
Thank you, you too.
For more information on Summa Health's maternity and women's health services, visit summahealth.org/women. And if you found this podcast to be helpful and informative, please share it on your social channels. And be sure to check out the full podcast library for additional topics of interest. This is Healthy Vitals, a podcast from Summa Health. I'm Scott Webb. Stay well, and we'll talk again next time.